My name is Mary Bacus, and for this Advocacy and Action project, I will be presenting on the prescription drug and heroin epidemic in Elmwood Place, Ohio. I have used the iThoughts app to create a flow chart to describe the experience. We'll begin by discussing the community of Elmwood Place and the problems that they are having. We will then move to the state of the problem in Ohio and discuss current legislation to combat the issue. Obstacles and support for the conquering the problem in Elmwood will be identified before describing my plan of action. I will conclude the project by discussing the meetings with Councilman Joe Anakin and reflecting on the things that went well for the project and the ways to improve interactions for future meetings. Elmwood Place is a small village in Hamilton County, Ohio, consisting of only 0.32 square miles. It is bordered by the town of St. Bernard to the south and is nearly surrounded by the city of Cincinnati. In 2010, the 100% urban population was 2,188 persons, 77% white, 14.5% black, and 3.6% Hispanic. The median household income is $20,786, and 37.9% of the residents live in poverty. 59% have a high school degree or higher, but only 2.5% have a bachelor's and 2% have a higher graduate degree. While looking for a community problem to address with this Advocacy and Action project, I was speaking with a small business owner in Elmwood. They were frustrated with the drug deals going on outside their shop and the thefts that had happened in the past several years. They suggested that I speak with City Councilman Joe Anakin about the current state of the problem. I learned from Councilman Anakin that 75 to 80% of the emergency calls made there were drug-related, with heroin and prescription drugs being the major culprits. Narcan, the reversal agent for an overdose, is being administered most times, and a growing portion of the village's budget is being used to cover it, because it is often not reimbursed by insurance. Many of their businesses have left or are considering leaving because of the drug problem. They have no resources for drug counseling and only a small amount for youth activities. With only a small pool and park, they are concerned that the children, especially with the summer months approaching, will not have constructive things to do and may turn to drugs. The prescription drug and heroin problem is not unique to Elmwood. It has become an epidemic in the state of Ohio. According to the Ohio Department of Health, in 2007, unintentional drug poisonings became the leading cause of injury death in Ohio, surpassing motor vehicle crashes. From 2000 to 2012, the death rate for unintentional drug poisoning increased 366%. On average, approximately 5 people die each year in Ohio due to drug overdoses. Overdoses are costing the state $5.4 million daily in medical and work loss costs. The Ohio Department of Health has 3 main ways they are combating the problem. First, collaboration, then naloxone distribution, and community projects. With collaboration, they have created the Prescription Drug Abuse Action Group. It is an ongoing multidisciplinary work group devoted to decreasing abuse and overdoses. It is the point of contact for sharing information and resources across the state. They have developed recommendations that have been incorporated into House bills and state laws. Currently, they are working on strategies to expand access to Narcan distribution programs, facilitate use of screening, brief intervention, and referral to treatment in healthcare settings. They're promoting adoption of opioid prescribing guidelines and increasing education of healthcare professionals. For the naloxone distribution portion, they have initiated Project Dawn, which stands for Deaths Avoided with Naloxone. This began in Portsmouth City Health Department in Scottsdale County. After the success here, they are currently giving resources, technical support, and financial support to expand the program to Ross, Stark, and Hamilton County. There are several community projects underway. They are trying to create public awareness about the problem, and it is called the Prescription for Prevention, Stop the Epidemic, to educate Ohioans on the misuse, abuse, and overdoses in drugs that are happening. They are trying to create medication disposal places for the cities by developing drug take-back event guidelines and permanent drug drop boxes. The VIPP, or Violence and Injury Prevention Program, was created with a grant from the CDC. It was created to implement comprehensive community-based efforts to address abuse and overdoses via coalition development, community needs assessment and evaluation, formation of a poison death review committee, and development of policy, systems, and environmental change strategies. In 2014, Ohio House Bill 170 was signed into law by Governor Kasich. It expanded lists of licensed healthcare professionals, emergency responders, and peace officers that could prescribe or administer Narcan. It provided nasal Narcan to family and friends of at-risk persons, and it helped increase the use of Narcan by granting immunity from prosecution to those acting in good faith and with reasonable care. The Village of Elmwood has many obstacles to face with its war on drugs. Over the last several years, there has been a lot of speculation on corruption in the city government. They have had 3 mayors in the last year and a half. Councilman Anakin is the most senior member with only 1.5 years of experience. Because they have lived for so many years here, they are all aware of the problems, but they lack the knowledge of where to find the support to solve them. Another obstacle faced is the lack of law enforcement presence. Due to a limited budget, they are only able to employ 1 full-time police officer and 12 part-time officers. There have been instances where business owners and citizens have called to report drug deals, and there weren't enough officers available to respond to the call. The third and largest obstacle is the lack of funding. With the balancing of the state budget in recent years, there has been less money available for small communities. This, combined with a low income tax and decreasing number of businesses operating in the village, leaves a small budget for the council to work with. While the village has had many obstacles to overcome in the recent past, they are encouraged that there can be change in the future. The new mayor and city council members are working on bringing more businesses into the village. They recently welcomed Rumpke Recycling. This larger business will bring more tax dollars into their budget. They are actively working on locating funding from the local, state, and national level for drug counseling and Narcan administration, and they are interested in hearing about ways to obtain grants for the children. The plan of action was to introduce the grant ideas to obtain funding for the children's projects and to inform the council of the Ohio Department of Health's initiatives to combat the drug epidemic. This information was described earlier in the presentation. There are 3 organizations who offered grants that look promising for the children's programs in Elmwood. The Data Foundation offers grants in Greater Cincinnati to carry out projects that benefit children in areas of arts, culture, education, healthcare, social services, and community needs. Several of the recent programs that were backed include group trips to the zoo and Power Up for Success. This program teaches computer skills to low-income children. They usually give out about 100 grants per year, averaging $10,000 to $15,000 per grant. The Greater Cincinnati Foundation gives out grants up to $1,000 to innovative education projects for kids during the school year and during the summer. The last foundation, Interact for Health organization, has given out more than 2,500 grants since 1996, many for school-age children's health care and for substance abuse disorders. After doing research on the state of the problem in Ohio and their policies and programs to combat the drug epidemic, I worked on creating a list of possible local grants that will be available to help create programs for the children of the village, as requested by the council. I met with Joe again in a follow-up face-to-face to present the opportunities to secure funding for the children from local foundations and to discuss support and funding from the state of Ohio to combat the drug epidemic. I answered all questions to the best of my knowledge and left him with the materials I prepared to share with the rest of the council. Overall, I felt this project went very well. Councilman Anakin was very kind in offering his time to spend with me. I believe that I was able to supply him with concrete ideas of how to increase funding, as well as visual aids to allow for further dissemination to the rest of the council. For further encounters, I would like to prepare a presentation for the whole council. I feel that my increased knowledge of iPad applications would allow me to create a visually appealing and informative presentation.